All right, good afternoon, everyone. I am really happy to be here. We have an outstanding panel this afternoon. I got to say, I was scrolling through the participant list, and I think this is as close as you can come to a health economics wedding. It's like all of our friends and in one place. This is really fantastic. Our panel today, we're going to talk about how to communicate our findings around health economics. So before I go on, I'll just say I'm getting some notifications to admit participants. If I don't know if somebody else can take over that because I might miss some of those notifications. My name is Yusuf Zafar. I'm a GI medical oncologist and the Chief Quality Innovation Officer at the Duke Cancer Institute. I've spent the past many years thinking about how cost impacts the patient experience. I am really fortunate to be moderating this outstanding panel. Today on our panel, I'll start with Dr. Erin Carroll. Dr. Carroll is a professor of pediatrics and associate dean for research mentoring and director of the Center for Pediatric and Adolescent Comparative Effectiveness Research at the Indiana University School of Medicine, as well as the vice president for faculty development at the Regent Streif Institute. He's a contributing opinion writer for the New York Times. The New York Times will be a recurring theme on our panel today, and is an editor-in-chief at the Incidental Economist. He's written 4 books and hosts a popular YouTube show, Healthcare Triage. Welcome, Erin.
Thank you, appreciate it. Glad to be here.
Next, we have Stacy Duzatina. Dr. Duzatina has appeared many times in the New York Times. Is an associate professor of health policy and the Ingram Associate Professor for Cancer Research at Vanderbilt University School of Medicine. She is a health services researcher focusing on the intersection between health policy, epidemiology, and economics related to prescription drugs. She received her PhD in pharmaceutical science from the University of North Carolina, Chapel Hill, just down the street from me in 2010, and postdoctoral training at the Department of Healthcare Policy at Harvard. And our third panelist represents the New York Times. Margot Sanger-Katz is a domestic correspondent for the New York Times, where she writes about healthcare for the upshot, which we are all very familiar with. Before coming to the Times, she was a reporter at National Journal and the Concord Monitor, and an editor at Legal Affairs and the Yale Alumni Magazine. In 2014, she earned completed a fellowship in economics and business journalism at Columbia University. So welcome to you all.
Everybody. Thanks.
So, you know, I think what we all want to know as we think about ways to get our research out there is how do we do it? And let's start a little bit broad and think about what are the skills that we need just in general? What are the foundations of good science communication? And why don't we start with Margot, since you are often on the receiving end of the science.
Yeah, so I should just say that I'm so excited to talk with all of you, and I'm always really excited to talk about this subject with researchers because I feel like you guys are the ones who are learning new things about the world, and like all of my best ideas come from you guys, and I think that very often researchers are scared of the media or like not sure what to do. And so I always feel like this is my opportunity to kind of psych you up and recruit you to pitch your ideas and also to pitch your best ideas to me in particular. And so, I think the main thing is that you guys really know what you know about, but you're used to communicating with each other. And it's a little bit of sort of like a specialized way of talking and writing. But the ideas that you are studying are often of interest to a much wider audience. And I like to think that us in the news media, and particularly us at the Upshot, are like really good sort of disseminators and translators of your ideas. And so I think like if you only walk away with like one piece of advice, it's don't be afraid to call a reporter and tell them what you're working on or email them. If there's something that you have discovered that you are really excited about, there's a really good chance that the world wants to know about it. And I think there's also a really good chance that if you have important findings, they're much more likely to have an influence over policymakers or other researchers if they are widely disseminated and not just circulated in your journals, in your kind of internal communication. So, you know, don't be shy. I I think maybe it's like a little bit helpful to just understand how reporters think and how we do our work, because I think it's different than what you guys do. I feel like you guys look for a really great question and then you spend a lot of time really thoroughly and carefully answering that question, and the sort of life cycle of one of your projects is often extremely long. And for us, it's like almost the opposite. Like there's just such a rapid fire of news. So things happen and we often have to learn about them and explain them really quickly. So this maybe sounds really elementary, but I think it's useful to think about like what news means, because I think it will help you understand what reporters are interested in. So there's lots of different ways of being new, right? So like news could be just like a thing that happened today, right? Like, you know, the CDC is voting on the right way to ethically disseminate vaccines, right? So like that's something that happened today or happened yesterday, super important. People want to know what the CDC said, and people also want to understand context around that. So like yesterday, if you are a person who has really interesting research or thoughts that are relevant to that, like that's a great place for you to participate. I think another kind of news is just like a new idea. So if there is some established body of thinking about a particular question and you come up with a result that shows, oh, we've been thinking about this wrong, or here's this new wrinkle, or just like something that like maybe is a little bit counterintuitive or changes the way that we should think about an important question, that's new, that can be news. I think that the kind of news for research that university public relations professionals often focus on is actually kind of like the least useful to us, which is like, your paper is new because it was published in a journal today. You know, some papers are so important that just like the fact that they are published is itself news, but most often what's going to happen is there's going to be something happening in the world and you have findings that are relevant to that, and your paper may be a year old or a month old, or maybe it's like in a working paper stage and it's like not quite ready, but it's super relevant to something that is being discussed. And I think you are reading the news, you are knowing what's happening in the world, you know the topics that your research is relevant to. And I think that sometimes a really good time to pipe up is when you have wisdom or findings that are relevant to what we're talking about. So reach out to the news media. Think about how we think and be sympathetic to the fact that sometimes we're just like super busy or easily distracted. And then I guess the last thing that I would say is just to really think about how to communicate with people who are not academics. Like, how do you pitch your idea? Like, how do you get across the transom of getting my attention? Because I am super busy and I'm really distracted and lots of people are emailing me all the time, and you kind of have to figure out how to just like get my little eyes to light up. Once you have done that, I will always read the whole paper and talk to you about it and talk to other researchers. There's kind of a whole process of me vetting what you have sent me, which involves me taking it really seriously. But you have to first get over the bar of just like getting my attention. And so this is a sort of counterintuitive piece of advice, but one thing I think you guys may want to consider is using Twitter. Not because Twitter is a good way of pitching journalists, although sometimes it is, but because I think it actually really forces you to think about how to convey complicated ideas succinctly. You know, if you only have 280 characters to communicate an idea, it's a real kind of discipline. I actually found like when I first started using Twitter, even for me, I'm a professional writer, super hard. And then I got better at it. And I think that, and Stacey, I'm sure can talk about this, and Aaron also, I think if you get really good at writing like a nice, sharp 280 character tweet, you are going to be really good at sending me an email that I want to read, because you will have thought about what is like the most essential, exciting thing that you have found, and how do you communicate that in a way that normal people are going to connect to. Yeah, anyway, so I'm happy to answer questions, and I want to talk more, but let me.
No, those are all really important points. And actually, earlier today, Stacey and I were just joking on Twitter that we should actually devote some time on how to do a tutorial just in this session. I'm not sure we'll get to that, but let's talk about, you brought up some really important points. Let's talk about the pitch for a second. Aaron, tell me a little bit, when you think about the pitch, I mean, you've been on both sides of this, right? You've received pitches and you've pitched. How do you think about that, particularly when it comes to health economics research?
I think people will be shocked at what a high rate people who pitch me actually get me to write about their stuff. I mean, it's just, if you're excited about it and you can get me excited about it, which doesn't take much given my nature, like I often can find a way to work that into a piece. It doesn't mean it'll be the sole topic, but I think that that's part of even what Margot was saying is I think people have a vision that, or researchers have a vision that they're going to get a huge article in a major, media place about their paper and their paper only. That will almost never happen unless it's a major, major paper. What's more likely to happen is that you get me interested about a topic, and then I wind up writing a column on that topic, part of which is mentioning some specifics about a bit of research that an individual has done. One of the things that I find that researchers fall down on is that they think that they're only qualified to talk about work that they've done with their own two hands, that unless it came out of their lab or was published with their name on it, that somehow they're not qualified to talk about it. When, again, I think even Margot was saying this, the vast majority of pieces that get done are about cancer or about some aspect of cancer, of which hundreds of thousands of people, at least tens of thousands of doctors are qualified to talk about it. In fact, many people with just an MD will be more than happy to wax philosophic about any topic, regardless of whether it falls into their area of expertise. In fact, that's what you see on TV all the time, are pundits who just talk about anything, when really you are more than qualified, if not exceptionally qualified, to talk about so much more than you're willing to. And so, building on that too, I think it's so important to start talking about your work early. Don't wait till the paper has come out. Why is it important? Clearly, most of the time, you've gotten the NIH to fund it, which means you've convinced them already this is an important topic. There's a gap in the world, and I'm going to fill it. That in itself is important. Start talking to the media about why your area of interest is important. Start talking to the media about what...
Sorry, let me push back, because now both you and Margot have mentioned this idea of getting the concept out there even before the paper is published. Boy, I got to tell you, as an academic researcher, that's not something I'm used to. So maybe at a conference if it's presented, but talk a little bit more about that. How do you do that? Why should we do that?
I'm stuck all the time. I remember one of the pieces that I wrote in the New York Times, I think it was years ago now, at least a year and a half ago, and it was back when I was at the Upshot, was about my best friend got cancer, and it was sort of about the toll on caregivers, that's how much it costs to just be a party to cancer is a huge economic burden that almost no one really recognizes. But having said that, the second I wrote it, everyone I knew in the cancer world was like, duh. And I'm like, you don't understand. No one knows that. To you, it's common knowledge, but you might be doing research on this area, but no one even knows it's an issue worth covering, let alone, that we need to do research and how are we going to fix this? Or how big is the problem in this cancer versus, when I delved into the literature, I was shocked at how many studies had already been done on this, given that I didn't even recognize that it was a problem. And I'm pretty plugged into a lot of stuff. So yeah. I think, getting journalists to recognize that even your area of interest is something worth covering or talking about, you'd be shocked at how easy that is. Moreover, it's something you could do. That's write an op-ed. I didn't have to write this piece. Anyone who knew about the literature could have written this piece. I think the issue sometimes is that we wait until the study is done and we think that's when you're going to go out and you're going to pitch it and people are going to be like, wow, we should cover that, when the groundwork has never even been laid for people to be open to the idea that this is something we need to cover. This is something that needs work being done. And now, oh my gosh, here is the work. Now I can fill that hole. Start way back, way back. Start talking to journalists about why what you're studying is worth covering or worth looking into even before the paper arrives. And now I'm going to also stop because I recognize we could each go on forever.
That's great.
I'll stop.
No, that's great. And again, please, anybody just jump in. Don't wait for me to call on you, Stacy. Bring us back a little bit to health economics, build on what Margot and Erin have talked about here. And when you talk to the media, how do you distill your very complicated concepts into something that is newsworthy the way Margot defined news?
Yeah, great question. So I think one of the things that is kind of the first lesson learned is you have to speak plainly. And this is so against our nature because, you know, when we present in an economics seminar, for example, you want to use technical language. You need to, or you'll get yelled at by other people in the room. But you have to learn that the public does not care about your standard errors. They don't want to hear about your marginal effects. They want to hear about dollars and changes or increases and decreases, terms that I think we're maybe not quite as comfortable using because they're not as precise or maybe don't tell the exact result from the paper. So I think you have to get really comfortable with that. I think Margot's point about learn how to say it quickly, succinctly, and to someone who is a non-expert. And I think once you've kind of gotten practiced at that, it makes it a lot easier to pitch your study. The other thing is that I think sometimes just going through sometimes the idea like the tutorial. So like when I have a new paper coming out that I'm excited about, sometimes I like to put together a set of tweets about it that explain the main findings. And it's really helpful for me to draft those, you know, like earlier in the day, I might open up a Word document, just kind of bullet point all the points I want to make and think about how to enhance that to reach a larger audience. But it really forces you to dive into the paper and pull out what is the most important aspect of it. I guess one last thing is I feel like, you know, we all know how long and burdensome the publication process can be and how we're so over a paper by the time it's getting published, like we've moved on mentally. I think it's important to kind of refresh your energy, like the energy you had when you asked that question in the first place, and like get back to that excited point so that you can really share the work with that enthusiasm. So then it, you know, people do pick up on that and you can really go a long way with your level of enthusiasm.
So I'm going to totally put you on the spot here, and I'm going to ask you to pitch to us as though we're the reporter, your study that I can't remember the last time I gave a talk and did not mention it. And of course that was your imatinib study, right? So do it.
Oh, see, this is what you don't do. You don't cold call. You prep. You know, I think what you want to do is kind of give people maybe a little bit of the opposite of what your press office wants to do. Your press office wants to pretend it's the only paper that's ever been written on this topic, and like, you know, and in fact, we all know that our work is centered around a body of work that is really interesting. So for that paper where we were looking at how out-of-pocket cost affected adherence or discontinuation of treatment for CML, chronic myeloid leukemia, you know, like I think the take-home messages for that are we see huge differences in people discontinuing treatment if they have higher out-of-pocket costs. We see that when we say higher out-of-pocket costs, that is like $75 or more. That's not like thousands of dollars. So it's kind of like, the reality is like even what we think of as not that high of an out-of-pocket cost is a lot for people and is causing them to quit taking their medications early. And oh, by the way, this is the best cancer drug that has ever been developed, period. And if you take it, you have a normal lifespan. And if you don't take it, you can die early. And by the way, Erin Carroll has written,
I was gonna say, like, part of this is like, it's not even just this, like I've pitched Stacy's piece to editors. I mean, it's the same thing of like how I have to pitch pieces to editors to get them published. So part of it again is like, I didn't write about it the day it came out because I don't care the day it came out. Like that's just what the journal picked because of its schedule. But there was a time when I wrote to my editors, and the way I would do it is say, like, you know, there's a lot of news right now about how, you know, do we need to reduce out-of-pocket costs for drugs, and are these having an effect on, no statistics. And I can tell you there are these studies, one of which was stated, where he says, like, what people would consider not even huge out-of-pocket costs can have significant effects of people that won't take drugs that literally mean the difference between life or death. And the editor's like, my God, write about that. That makes total sense. So it wasn't that, oh, here's a study. It was, here's something in the news. Here's an issue people are talking about. There's lots of literature on this. I have this study, this study, this study, but you clearly will be pitching your own. But people don't know this, and we could inform them based on evidence and data that we do know something about this. This is not an unanswerable question about which politicians can just debate. We can inform this policy discussion with actual research and data. And I really genuinely believe editors eat that up. They want that. Margot may have more to add on that, but that's the argument you use.
My former editor, David Leonhardt, who is like a world-class communicator who won a Pulitzer Prize for really great explanatory journalism that he did about economics, he has this line about headline writing where he says, a good headline is a single declarative sentence with a verb. And I just want to really highlight the verb part, because I think that a lot of academics like to write about nouns. So I could imagine Stacy's paper being described as, I have a new paper about the effects of variable cost sharing on medication adherence in cancer. That does not excite me. But the way that both Stacy and Aaron just described it really emphasized the verb, right? Which is even relatively moderate out-of-pocket costs can prevent people from taking life-saving medicine, right? So the fact that this thing is causing this effect, that is the kind of writing that is more likely to get a journalist's attention. And that's the kind of writing, obviously, that makes for a great headline that's going to make people want to read an article. And so that's my number one pitching advice, is to think about the verb, think about the action. Don't just tell me what the topic is, tell me what you actually found.
And so, Margot, how do we balance that really catchy, punchy story and headline with a fear that I think a lot of us have, which is overstating our data?
Yeah. Mm-hmm. Well, I mean, I think it is a challenge, but you guys all know what it is that you found. So I think you have to find the thing that you can say that is the strongest and most interesting finding that is true. And I think every article that is good is going to include some caveats about, okay, this may not be true for every disease like this, but it's suggestive of that, or this group was special in some way, or this research was only done in mice, which is actually a pretty big caveat that we maybe deserves more foregrounding. But I think, again, I think it's important to differentiate between the headline and the article, between the subject line of your email and the body of your email. The pitch is a way, or the headline for me is a way of getting the attention of your reader, and it has to be true. I think it has to be true. It can't be exaggerated, and it can't mischaracterize what you found. But I think you want to think about what is the sexiest way that I can describe what I've done. But then there's the article, and the article is going to give more of that nuance. And I think, the same thing when you're communicating your findings, don't say something that is exaggerated or that is not true. But I think it's okay to lead with the most interesting, the most surprising thing that you learned, and then follow up with the additional detail.
Yeah, and I mean, what caught me when you said it, Stacey, when you summarized, and I knew you were going to say this, which is why I knew I could put you on the spot, right? Is you said a dollar figure, and you said who it impacts and why it impacts them so clearly. And that's exactly what we need to do. But a lot of times we're talking about super, super complicated topics within health economics. And look, I mean, health economics is health policy as well. And we've all had to talk about really complicated, I mean, nothing's really happened in health policy that's been complicated in the past, few years, but let's go back a little bit more and talk about something like the ACA, right? How do we help our lay audience? First of all, I guess we should define who our lay audience is. How do we help them understand how our research on the ACA, for example, should inform their lives and their decisions? Anybody?
I mean, I'll just, only because the ACA is literally what got me started in all of this. So that's when we started our blog in like 2009, 2010. That's all we wrote about. I mean, every day, all we wrote about was there's something being discussed about the ACA. We grabbed something out of the literature and we talked about why, you know, whether it was about cost sharing or the moral hazard or how different types of insurance design could affect coverage, would affect access or quality or cost, or how all of those things intertwine. And there's an unending literature on all of that the vast majority of people have no exposure to whatsoever. And I spent countless hours, you know, just actually being on call-in radio. I had a friend I developed a friend, but at the time he wasn't, but where I would do sort of an hour on his show on Sirius XM every week, just answering questions, which was the most useful thing I think I've ever done. Because after a year of taking call-in questions about the ACA, there was no question anyone could ever ask me again that I was not prepared for or that I could not offer a soundbite for on the ACA. And it was like that kind of practice and exposure, which makes a huge difference. But one of the good things about health economics, which I think even differentiates it from a lot of more basic science work, is it's much easier to talk about what this means to actual people. You know, health economic studies have a much clearer direct application to the real world than a mouse model, where I totally feel sympathy for people who are trying to pitch that story to the media about why, you know, everyone should get excited. But I don't even know if there's a health economics study that gets published that I can't, you know, make it about the world and why it should make a difference and how it'll actually impact people's lives. And the ACA is a great example. I mean, it's a great example because it affects so many people and it has such, you know, a large impact that even with respect to cancer, I see colleagues, you know, publish and talk about that kind of work all of the time. But part of it is doing it. I think Margot hit the nail on the head. You have to talk about why this impacts people. You have to talk about why we should care above and beyond, I got a publication. Because what the academic environment cares about in terms of the importance of your work versus what the world thinks about is with relation to the importance of your work are two different things. And learning to speak this language doesn't come intuitively to a lot of researchers, but it's massively important.
I think just one other thing to add to that is, you know, if your audience is a policymaker, thinking about how to de-risk the language when you're talking about, you know, the Affordable Care Act or Obamacare, it's like if you really want to make a point about a particular policy and how it's helping or harming, and you need to be able to work across the aisle, it's important to be able to just talk about the policy, talk about how it, you know, hurts particular patients or helps some patients and why it should be expanded in a certain way. You know, using the information to recognize that the choices of words that you use really matter as far as getting people to even be able to engage in a conversation. And, you know, I think over the years, we've seen different things like that about how even the public has reacted to the Affordable Care Act and, you know, their general feelings of pro or con or whatever. But I think it is really important to think carefully about your audience in all of these scenarios and tailor appropriately.
Mm-hmm. That audience part is so important that I think you've all brought up, right? And one interesting audience that Scott Ramsey actually mentioned in the comments is grant reviewers, right? I think we talk about message often and we think about media, but my goodness, if we have to message well to anybody, it's grant reviewers, right? Stacy, can you talk about that a little bit in terms of how you think about communicating in language when it comes to writing your grants?
Maybe I'm not the best person for this one particular thing. I'm still trying to recover from the analysis of R01 funding.
Yeah, join the club.
From this morning. You know, I think it's really important to remember you're talking to scientists there. You know, you're really trying to reach the scientific audience. And of course, you know, we have to remember that not everyone has the same expertise, so you want to connect the dots as much as possible around the clinical importance of the area, the importance to patients. Of course, we know from NCI, how important it is that all of this is tied directly to patient outcomes. So I think making those pieces clear is really important, but I guess I would think that you'd have to lean a little bit heavier into the pretend you're presenting to the health econ seminar side of things rather than pitching your work to Margot at the New York Times. So that's just my general gut reaction.
So I'm going to be a little bit, I think, different in how I might answer that, because I have found that nothing has benefited my grant writing more than learning to write, concise 800-word columns. In fact, it's like any of us, and I'm sure most of us here have been on a study section. The worst thing that can possibly happen is the day you finally get around to, looking at the pack of grants you've been handed is to realize you've got 200 pages of dense material to go through. In the same way that I described a story, I feel like my grants have become here's a problem, here's what we know, here's the hole, here's why we're the people to fill that hole, here's what we want to do. And I'm just going to make that as simple as possible and try, because again, I've become convinced over time, the people who review the grants are human beings. And if they're having a bad day, which happens, they're just not predisposed to love your grant. So as easy as you can make it for them, not only to understand, but also sell it to others, because that's legitimately what they have to do in the study section, just like we have to sell to journalists, just like journalists have to sell to editors, spoon feeding it so that they can take it and then go read and be like, look, I now have the presentation laid out how I'm going to present in study section, and it's boiled down to as few words as possible, and I can, and it's crystal clear, and they've just repeated the messages over and over again till I got them. That's it. I think it's drastically affected my grant. I think my grants are much easier to read now than they were 10 years ago, and a lot of that is because I'm trying more and more to write clear language that almost anyone could understand. So granted, I have no idea if that's right or not, but my experience has been that the more I can make it transparent and easy, the better it is.
Erin, I think the comment you made about repetition is super important. I remember that being one of the things I learned in a grant writing class, and I thought it seemed crazy to just repeat the same thing over and over and over again, but it was an incredibly successful grant writer who was providing the lecture and giving this kind of template. And I think that's exactly right. You have tired people who've just gone through a large stack of grants. They are pressed for time. They might be on an airplane in a different world. And, I do think that the repetition helps you to get the key points. So yeah, never hurts.
Can I say something about writing, which is not specific to grant writing, but I think applies to grant writing, it applies to pitching, it applies to writing op-eds, and I think it probably applies to writing your papers too, is that, and it actually took me a really long time to realize this, even though this is what I do for a living, but writing is like anything else. It's just the more you practice doing the kind of writing that you want to do, the better at it you get. It's I think that I used to have this idea that there are good writers and there are bad writers. And of course there's some of that, but I also think that you will be surprised at how much better at writing you can get if you just practice the kind of writing that you want to do. And so if what you want to do is write a great op-ed so that you can disseminate your research in a major news organization, you should once a week, try to write something like that. If you want to get good at writing pitches, write pitches. If you want to get good at writing grants, write grants. And I think it's important not to get discouraged or to think that writing is something that you're not strong at. I think, Erin just talked about how this huge learning curve of having to be forced to write for a news audience has really helped his writing in lots of other ways. My bias is of course always in favor of being as clear and, plain spoken as possible while still conveying your findings with subtlety and nuance. But And again, like this is again why I sort of am such an enthusiast for Twitter, even though I think it has a lot of downsides. It can be a huge time waster and it can also be a sort of toxic place. But I think that it kind of forces you to just like to use that muscle a little bit, you know, if every time you see a paper or you see an article that you think is really interesting or you think has some point that you want to share with other people, you force yourself to summarize that in a sentence or two. I think, you know, that's just a good kind of like daily calisthenics that may pay off in other parts of your writing.
Yeah, great comment from Ann Geiger, right? A mentor of mine long ago taught me that everyone likes plain English. Can't say it plainer than that, right? So you guys you talked about this a ton already, and Margot, you again just mentioned toxic time wasting Twitter. So let's go there. Let's talk about the role of social media. You know, we think more and more about different ways to get our message out there, and it's not just the journal article anymore. It's not necessarily just the grant. We are all on Twitter. So by definition, we all waste time. Erin, you have a strong presence on YouTube as well. Tell us a little bit about the YouTube experience actually before we get to Twitter, because not all of us have spent a lot of time producing that kind of content.
I mean, I fell into YouTube, so it was never an aspiration of mine. But each of these, like where I feel like that I exist or where I try to do dissemination, it's a different audience that consumes information in a different way, and there's less overlap than you might expect, I think, between some of these groups. And if you're trying to reach a wide audience, you know, I find trying to use a variety of different media work. I will often cover the same thing in a podcast and a video and a column and tweeting, whatever else I'm doing. YouTube tends to skew younger. You get more of a 20s and 30s audience, but it is a little bit easier to sort of be evergreen because you can just, you know, again, use social questions, and I find it to be enormously useful. I also found that in surprising ways, it still reaches an academic or journalistic or policy audience that otherwise might not have seen it, even in very high profile places. I will sometimes get emails from people I've covered their work, and they finally saw it when I did it on YouTube, not if I wrote about it in the New York Times, which shocks me. But I don't know why. But it also, I think, just again, and I like to do a lot of this because I think it builds up my skill set of communication. As Margot said, just practice doing it over and over. If I make videos, I get really good about speaking about things and realizing how can I squash that in, and it improves my presenting skills. If I'm talking on the radio all the time, it forces me to learn how to answer questions and, you know, figure out how to answer things and be able to talk on the spot. All of which clearly serve me well in my real job as well. And so it's just different. And it's not for everyone. Like, everyone doesn't have to do everything, but I think that YouTube and video can be incredibly powerful in trying to reach different audiences that you would certainly not get at by, you know, writing in print or on, you know, the internet.
Yeah. Yeah. And Stacy, you know, I was only half joking apparently today when I said on Twitter to you that we're going to spend some time talking about tutorials. So tell us a little bit. There've been some comments about this as well in the chat. Tell us a little bit about how you do it, when it's useful. What's the art behind the tutorial?
So I'll say first, if you're going to be on Twitter, you actually probably need to invest a little bit of time in being on Twitter. So you can't just like show up when you have a paper and tweet it out and expect a bunch of people to be excited about it. You kind of need to be somewhat engaged on the platform, you know, follow relevant things. I will also give my 2 cents that I noticed as an academic that I knew about new research that was interesting to me earlier than I would have without Twitter. So I found like early on that was a big benefit, is I'd hear about a study, and then by the time I had colleagues emailing me about this study that they knew I'd be interested in, I had already read it a couple of days before. So I feel like there's some benefits related to being on Twitter in general. So you kind of need to be on there and have a presence. But, you know, I think the other piece is trying to connect with people and in a positive and kind of funny way, I think is one of the things that I like the most. Is like, I like really dumb comedies. I love, you know, The Office. I love silly pictures, you know, cartoons, things that can actually make it a little bit more lively. You know, you have to choose your paper. So I can tweet pictures of donuts when I talk about Medicare Part D because of the donut hole. You know, I'm not going to do that necessarily if I'm talking about end-of-life care for patients with cancer. So you got to really think about your topic and is it appropriate to use humor? But assuming that it is, assuming you're talking about something in the policy realm or related to spending, use humor if that's kind of part of your personality. Another thing that you can do and should do is take, you know, get a picture from the study, for example, and tag people in the picture so you know you have people who have followers who are your friends, who know you, and who may be interested in both reading it and retweeting your content. And that's another way to kind of get the information disseminated kind of faster. So I think that there are just a few little tricks that you pick up along the way. I certainly don't think I'm an expert at it. I just kind of got lucky the first couple of times I did it. They were really popular, but some of it was just, you know, they lined themselves up really nicely to be kind of funny, which is my favorite part of being on Twitter is cat pictures and jokes.
Yeah, I've noticed actually. Yeah, I think you made some really important points there about how to appropriately use, you know, different aspects of social media, and the tone as well becomes really important. So we only have a couple of minutes left, and I'd like to spend it talking about something, Margot, you mentioned early on, and that's a fear that we have in talking to the media, and the fear of making mistakes or saying something wrong. I remember a few years ago, I was talking to a reporter who was calling me about the pricing for Kymriah, right? CAR T therapy, $500,000 per treatment. And at the time it was only for kids with acute leukemia. And I said to her, you know, basically through all my comments, that this is too expensive, right? And basically her response to me was, so, you know, why do you hate kids with leukemia? and that's, you know, we have a tendency to sometimes get painted into a corner. Again, vast majority of journalists out there are not out there for the gotcha moment. Margot, how can we make ourselves more comfortable with that concept and not worrying as much about getting trapped and being afraid?
I think there's sort of like two ideas that you kind of have to hold in your head, which are somewhat in tension. So like one is that our goal is not to make you look bad or to distort what you're trying to say. Like our goal is to actually like convey honestly the information about some topic, right? Like something that's happened, some change in thinking, some controversy. And like, we want to work with you. You know what I mean? Like, I'm not like interviewing you and then you make a mistake and I'm like, oh yes, now like I can make this person look bad. Like, of course I don't want to do that. So, you know, if you make a mistake, I think it's totally fine to just be like, oh, that's not quite right. What I really mean is this, or, you know, follow up. But I do think that the thing that is hard, and I think this is particularly hard for a lot of academics who like to be really careful about all of their kind of written communications, is that like, it is true that you really don't have control over the story, right? Like if you're working with a journalist, I think you want to work with a journalist that you feel like you can have some trust that they are professional and that they are taking their job seriously and listening to what you're saying and consulting other sources and reading your paper so that they're not going to mischaracterize what you say or try to trap you in some way, you know? But on the other hand, like it's not your piece of work, it is their piece of work. So I think it's sort of, there has to be a lot of trust involved. You have to sort of trust that the person you're working with is going to do a good job. And I really do think that like, we just don't come to this profession to try to like screw over researchers. Like we come to this profession because we want to inform the public about matters that are important. And like, we want people to actually learn the truth. So have some faith that that is what our ultimate goal is. But then I think also you do have to sort of trust like, okay, I'm going to like give my comments, I'm going to give my work, I'm going to give my ideas to this other person. And sort of be willing to understand that like what they are going to present is not going to always be exactly the way that you would present it yourself. You know, there is sort of through the process of dissemination, there's going to be some changes in emphasis or maybe some distortion or some difference of opinion. They may quote someone who's critical of you. They may emphasize this part of your paper when that part of your paper is what you're most excited about. And I think, you know, if you are engaged in like a serious good faith conversation with a journalist and then you can kind of like take a deep breath, I think it mostly goes pretty well. I think the times it doesn't go well or when you're working with someone who just maybe like isn't up to the task of writing about your topic, or when you're sort of too uptight and controlling and nervous and you don't actually give the journalist something interesting, or you don't understand that the way that your ideas need to be communicated to a general audience might be a little bit different than the way that they should be communicated to an expert audience.
Well, with that, we are exactly at time. This has gone by way too fast for me. I got to tell you, all three of you are my heroes, all for different reasons. Thank you so much for doing this. It's been a pleasure.